Hey guys, it's John again with Contract Diagnostics, and I wanted to do a message on artificial intelligence. I could do 100 messages on this stuff. We use it here at Contract Diagnostics. Never to review a contract, but to help us get ideas for blog posts or to summarize new CMS rules, more coming out on that later, or analyzing our data that we have internally. Of course, we blind everything before we put anything into a global system. We do have a custom tool here that has everything housed privately, but that's for another podcast and a different discussion. But I wanted to talk about artificial intelligence now because it's come up a couple of times in some of our negotiation reviews with employers. And it's one of those things that employers are currently struggling with. They're trying to figure out, how do they set policy around artificial intelligence? How do they say what a physician can or can't use during their job to help them accomplish a task? What can they look up? How do they trust that system? If they look something up and use something, what's the downfall if it's not correct? So administrators across the country are coming up, they're having compliance meetings, they're having lots of back and forth conference calls and everything else to try to figure out what they need to do as far as put in place policies around the use of artificial intelligence. We know that some employers have policies around social media, who you can be a friend with, what you can post a picture of, what you can't. We know they have outside activity policies with what you can and can't do in your spare time, some very restrictive and some not. I've seen dating policies before. We've talked vaccine policies, of course, in the past and most recently with the pandemic. But it's going to be interesting what these corporations are going to come out with in terms of, and private practices as well, on what they come up with as far as how they handle artificial intelligence and use during the workday. We don't know what's going to come out as far as tools that you guys will be able to use that may be baked into your electronic health records. I think that might be very cool on how you could have an assistant, if you will, analyze a patient's charts and make recommendations that maybe you haven't thought of. Or maybe it might find a drug interaction, or it might find something with genetics that you could proactively discuss with the patient. So I'm really excited about the future of artificial intelligence and how it's going to make our lives better and more efficient in many, many different ways. As a business owner and as a father, I also have many concerns and fears of it in the future. But it's something that I think we all need to embrace because it's not going to go away. And as your employers come up with policies to guide the use of appropriate artificial intelligence inside organizations, we encourage you to keep us posted on what they say. We encourage you to let us know what your organization is allowing or not allowing. We encourage you guys to tell us how you are using it. And I think that's very interesting from my perspective as well. So I want to talk a little bit today about artificial intelligence, the new systems, what these language models are doing, and how layover for many different applications in the future might impact everybody's job. And I think it's interesting on how hospitals are struggling with how to propose compliance regulations and policies around this. So enjoy using artificial intelligence. It's super fun, whether you're using it for jokes or to write a poem or to get an ingredient list for a recipe, or if you're using it to analyze patient charts and records. No, it's not 100% accurate. Every tool we've tested is less than the accuracy that we would expect here at Contract Diagnostics, which is why we use it for some things to start, but never to finish. And we never use it with a contract review because there's just so much information that goes in and so much care that we put into it. So if we can help you with yours, reach out and give us a call. We'd love to help. Find us at contractdiagnostics.com anytime.